If you are over 60 and feel sudden confusion, dizziness, heart palpitations, or unexplained weakness, the cause may not be aging or stress. Hidden electrolyte imbalances can quietly damage both the heart and the brain in seniors. Sodium, potassium, magnesium, and calcium control electrical signals, fluid balance, and nerve function. When even one of these minerals falls out of balance, serious symptoms can appear without warning. In this video, a doctor explains which electrolyte imbalances are most dangerous for seniors, the warning signs you should never ignore, and why early detection can prevent long-term heart and brain damage. Electrolytes are minerals that carry electrical signals throughout the body. In seniors, these signals are essential for keeping the heart beating regularly and the brain functioning clearly. Sodium, potassium, magnesium, and calcium each play a specific role, but they also work together as a system. Sodium controls fluid balance and nerve communication. Potassium regulates heart contractions and muscle function. Magnesium calms electrical activity and stabilizes rhythm. Calcium triggers muscle movement and supports nerve signaling. When these minerals are balanced, the heart and brain function smoothly. As people age, this balance becomes more fragile. The body absorbs electrolytes less efficiently, and regulation by the kidneys and hormones slows down. Even small imbalances can have noticeable effects. This is why seniors may experience sudden symptoms that seem to appear without cause. Understanding electrolytes as a connected system helps explain why heart and brain problems often occur together when imbalance develops. Unlike many nutrients, electrolytes do not need to be severely low to cause problems in seniors. Mild imbalances can disrupt electrical signals enough to trigger symptoms. The brain is especially sensitive to changes in sodium and calcium, while the heart is highly responsive to potassium and magnesium levels. When one electrolyte falls, others are often affected. For example, low magnesium can make it difficult to maintain normal potassium levels. Low sodium can alter calcium balance and affect nerve signaling. This chain reaction increases risk. Seniors may notice confusion, dizziness, fatigue, palpitations, or weakness. Because these symptoms overlap with common aging complaints, they are frequently ignored. However, these are often early warning signs. The body is signaling that electrical balance is under strain. Recognizing that electrolytes work together helps seniors understand why symptoms may involve multiple systems at once. Electrolyte imbalance often develops gradually. Daily habits, medications, and health conditions slowly shift mineral levels over time. The body compensates at first, masking symptoms. Eventually, compensation fails, and symptoms appear suddenly. This delayed response creates confusion and fear. Seniors may feel fine for weeks, then experience sudden heart rhythm changes or mental fog. The heart relies on precise electrical timing to pump efficiently. The brain depends on stable electrical signaling for memory, focus, and coordination. When electrolytes are out of balance, these systems lose precision. Even brief disturbances can increase risk of falls, fainting, or arrhythmias. Because symptoms can fluctuate, seniors may delay seeking care. Understanding this gradual process explains why early testing and monitoring are essential. Waiting for severe symptoms increases the risk of serious complications. Electrolyte imbalance is rarely caused by a single factor in seniors. It usually results from overlapping influences. Medications, reduced appetite, dehydration, illness, and chronic conditions often act together. Each factor may seem minor alone, but combined they strain the body's ability to regulate minerals. This makes seniors more vulnerable than younger adults. Awareness is the first line of protection. When seniors understand how electrolytes support heart and brain function, they are more likely to recognize early warning signs. This knowledge shifts care from reaction to prevention. In the next part, we will examine the most dangerous electrolyte imbalances individually, starting with sodium and its effects on the brain and heart. Understanding each mineral's role helps clarify why maintaining balance is essential for long-term health and stability in older adults. Sodium is one of the most critical electrolytes for seniors because it directly affects both brain function and heart rhythm. Sodium controls how water moves in and out of cells. When sodium levels drop too low, water shifts into cells and causes swelling. In the brain, this swelling disrupts nerve communication and impairs mental clarity. Seniors may feel confused, forgetful, or mentally slow. These changes often appear suddenly and are commonly mistaken for normal aging. At the same time, sodium plays a role in electrical signaling within the heart. Low sodium can interfere with the transmission of electrical impulses, making heart rhythm less stable. Some seniors experience palpitations, weakness, or shortness of breath without chest pain. Because symptoms involve both the brain and heart, they may seem unrelated. This makes low sodium especially dangerous. Even mild sodium imbalance can have a strong impact in older adults because the brain and heart are less able to compensate for changes in fluid and electrical balance. Brain symptoms are often the earliest warning signs of low sodium. Seniors may notice difficulty concentrating, slower thinking, or sudden changes in mood. Balance problems are common and increase the risk of falls. Headaches, nausea, or unusual fatigue may appear as sodium continues to decline. In more severe cases, confusion can worsen rapidly, leading to disorientation or even seizures. These symptoms reflect increasing pressure within brain cells. At the same time, heart symptoms may quietly develop. Low sodium can reduce blood pressure and alter heart rhythm. Seniors may feel lightheaded when standing or notice irregular heartbeats. Because these symptoms fluctuate, they are often ignored. However, fluctuating symptoms still signal instability. When brain and heart symptoms appear together, low sodium should always be considered as a possible cause. Early testing is essential because brain injury can occur if sodium levels fall too quickly or remain low for too long. One reason sodium imbalance is so common in seniors is medication use. Diuretics, antidepressants, and certain seizure medications can lower sodium levels by altering hormone signals that control water balance. Seniors often take multiple medications, increasing risk. Excessive water intake is another hidden cause. Drinking large amounts of water without electrolytes can dilute sodium in the blood. This is especially dangerous for older adults with reduced kidney efficiency. Illness also plays a role. Infections, vomiting, diarrhea, or hospitalization can rapidly shift sodium levels. Even after recovery, sodium may remain low. Because these causes are common, sodium imbalance can develop quietly. Seniors may not feel unwell until levels are already dangerous. This explains why symptoms can appear suddenly after days or weeks of imbalance. Awareness of these causes helps seniors understand why sodium levels should be monitored when risk factors are present. The most dangerous aspect of low sodium is how quickly symptoms can escalate. Mild confusion or weakness can progress into severe neurological symptoms within hours if sodium drops rapidly. Seniors have less tolerance for these changes. The heart may also become more electrically unstable during this time. This combination increases the risk of falls, fainting, and emergency hospitalization. Fortunately, low sodium is treatable when identified early. A simple blood test can confirm the diagnosis. Treatment must be carefully controlled. Raising sodium too quickly can damage the brain, while delaying treatment increases risk. This is why medical supervision is essential. In the next part, we will examine potassium imbalance and how low potassium quietly disrupts heart rhythm and muscle function in seniors. Understanding potassium's role builds on sodium's effects and helps explain why electrolyte imbalances often occur together rather than in isolation. Potassium is one of the most important electrolytes for maintaining a steady heart rhythm in seniors. It helps control how electrical signals move through heart muscle cells and determines how strongly the heart contracts. When potassium levels drop, these electrical signals weaken and become irregular. Seniors may notice palpitations, skipped beats, or a racing heart that appears without exertion. Potassium also supports muscle function throughout the body. Low levels can cause muscle weakness, cramping, or fatigue. Because the heart is a muscle, it is especially sensitive to potassium changes. As people age, the body becomes less efficient at maintaining potassium balance. Absorption from food may decrease, and kidney regulation may change. Even small drops in potassium can have noticeable effects. This is why heart rhythm symptoms can appear suddenly in older adults. Understanding potassium's role helps explain why low potassium is a common but dangerous cause of arrhythmias in seniors. Low potassium often affects the heart before other symptoms become obvious. Seniors may feel irregular heartbeats during rest or at night. Some describe a fluttering sensation or brief pauses in the heartbeat. These rhythm changes occur because potassium controls the reset phase of each heartbeat. When potassium is low, the heart struggles to recover between beats. This increases the risk of dangerous rhythm disturbances. Weakness and fatigue are also common. Muscles may tire easily, even with light activity. Seniors may have difficulty standing up or walking for long periods. Constipation can occur due to slowed muscle movement in the digestive tract. These symptoms are often dismissed as normal aging. However, when heart rhythm changes appear alongside muscle weakness or cramps, potassium imbalance should be suspected. Early recognition allows for safe testing and correction before more serious complications develop. Medications are a major cause of low potassium in seniors. Diuretics prescribed for high blood pressure or heart conditions increase potassium loss through urine. Some medications for asthma or insulin use can also shift potassium into cells, lowering blood levels. Digestive losses contribute as well. Vomiting, diarrhea, or laxative use can quickly reduce potassium levels. Poor appetite or restrictive diets may limit potassium intake over time. Dehydration worsens potassium loss and makes symptoms more severe. Seniors with kidney disease face additional challenges as potassium regulation becomes less predictable. Because potassium levels can fluctuate, symptoms may come and go. This creates false reassurance. Seniors may feel better temporarily, even though imbalance persists. Regular monitoring is essential when risk factors are present. Understanding these causes helps seniors see why potassium imbalance is common and often overlooked. Low potassium rarely occurs alone. It is often linked with low magnesium or low sodium, creating a more dangerous imbalance. Magnesium is required to maintain normal potassium levels. When magnesium is low, potassium is lost more easily. This interaction makes heart rhythm problems harder to correct unless both minerals are addressed. Seniors with combined imbalances face higher risk of arrhythmias. Because potassium affects electrical stability, even mild deficiency can have serious effects in older adults. Testing is essential whenever heart rhythm symptoms appear. Treatment must be guided by healthcare professionals, especially for seniors with heart or kidney disease. In the next part, we will focus on magnesium imbalance and its role in calming the heart and stabilizing the nervous system. Understanding magnesium completes the picture of how electrolytes work together to protect heart and brain health in seniors. Magnesium plays a calming role in the body, especially for the heart and nervous system. It helps regulate how electrical signals are transmitted and prevents cells from becoming overly excitable. In seniors, magnesium is essential for keeping heart rhythm steady and nerves functioning smoothly. When magnesium levels are low, the heart becomes more reactive to electrical impulses. This can lead to palpitations, skipped beats, or sudden rhythm changes. Magnesium also helps muscles relax after contraction. Without enough magnesium, muscles may twitch, cramp, or feel tense. Because the heart is constantly contracting and relaxing, it is particularly sensitive to magnesium imbalance. As people age, magnesium absorption from food may decline. Kidney regulation also changes, increasing the risk of deficiency. Many seniors have low magnesium without realizing it. Symptoms are often subtle at first, making deficiency easy to miss. Understanding magnesium's calming effect helps explain why low levels can quietly destabilize heart rhythm and increase nervous system sensitivity in older adults. Low magnesium often worsens other electrolyte imbalances. Magnesium is required to maintain normal potassium levels inside cells. When magnesium is low, potassium is lost more easily through the kidneys. This combination increases the risk of arrhythmias. Seniors with both low magnesium and low potassium are at especially high risk for heart rhythm disturbances. Symptoms may include palpitations, anxiety, restlessness, or difficulty sleeping. Some seniors wake at night with a racing heart or a sense of panic. These episodes are often mistaken for anxiety, but magnesium deficiency may be the underlying cause. Magnesium also affects brain function. Low levels can increase nervous system excitability, leading to irritability, poor concentration, or headaches. Because these symptoms overlap with stress or aging, deficiency often goes undiagnosed. Recognizing magnesium's role in stabilizing both heart and brain function is essential for understanding why symptoms may persist until magnesium balance is restored. Several factors increase the risk of low magnesium in seniors. Long-term use of acid-reducing medications can interfere with magnesium absorption. Diuretics and certain antibiotics increase magnesium loss through urine. Poor dietary intake also plays a role. Foods rich in magnesium, such as whole grains, nuts, seeds, and leafy greens, may be limited in senior diets due to digestion or dental issues. Chronic illness, stress, and inflammation can further deplete magnesium stores. Alcohol consumption increases magnesium loss as well. Because magnesium deficiency develops gradually, symptoms may appear suddenly after a trigger, such as illness or medication changes. Blood tests may not always reflect total body magnesium levels, making deficiency harder to detect. This is why symptoms and risk factors must be considered together. Awareness helps seniors understand why magnesium imbalance is common and often overlooked. Correcting magnesium imbalance requires careful management. Mild deficiency may be addressed through diet, while more significant deficiency may require supplements under medical supervision. Seniors with kidney disease need special caution, as excess magnesium can be harmful. Slow, steady correction is safest. When magnesium levels improve, heart rhythm often becomes more stable, and nervous system symptoms may ease. Because magnesium interacts with other electrolytes, treatment often improves overall balance. In the next and final part, we will focus on calcium imbalance and its role in muscle contraction, nerve signaling, and heart rhythm in seniors. Understanding calcium completes the full picture of how electrolyte imbalances can quietly damage the heart and brain. Together, sodium, potassium, magnesium, and calcium form an interconnected system. Maintaining balance across all four is essential for protecting long-term health and stability in older adults. Calcium is best known for supporting bone health, but it also plays a vital role in heart rhythm, muscle contraction, and nerve signaling. In seniors, calcium helps trigger each heartbeat by allowing heart muscle cells to contract properly. It also supports communication between nerves in the brain. When calcium levels fall too low, these processes become inefficient. Seniors may experience muscle weakness, cramps, or unusual fatigue. Heart rhythm may become less coordinated, leading to palpitations or irregular beats. Because calcium works closely with sodium and potassium, imbalance in one mineral often affects others. Low calcium can increase nervous system sensitivity, causing tingling sensations, anxiety, or difficulty concentrating. These symptoms are often subtle and easily overlooked. As people age, calcium absorption from food declines, and hormonal changes affect regulation. This makes seniors more vulnerable to imbalance. Understanding calcium's role helps explain why deficiency can quietly affect both the heart and the brain in older adults. Low calcium can affect heart rhythm in different ways. Some seniors experience slower or weaker heart contractions, while others notice irregular beats. Calcium helps control the strength and timing of each heartbeat. When levels are low, the heart may struggle to pump efficiently. This can lead to fatigue or shortness of breath during mild activity. Calcium also stabilizes nerve signaling. Deficiency may cause numbness around the mouth, tingling in the fingers, or muscle twitching. In the brain, low calcium can impair focus and increase irritability. Severe deficiency can trigger muscle spasms or abnormal heart rhythms. Because symptoms often involve muscles, nerves, and the heart, they may seem unrelated. Seniors may assume symptoms are caused by aging or stress. However, when muscle twitching, tingling, and heart symptoms appear together, calcium imbalance should be considered. Early recognition allows for testing and safe correction before complications develop. Several factors increase the risk of calcium imbalance in seniors. Reduced dietary intake is common, especially among those who avoid dairy or have limited appetite. Vitamin D deficiency further reduces calcium absorption from food. Certain medications, including diuretics and thyroid treatments, can affect calcium levels. Kidney disease alters calcium regulation and increases risk of both deficiency and excess. Digestive disorders may impair absorption. Long-term inactivity and limited sun exposure also contribute indirectly by affecting bone and mineral metabolism. Because calcium levels are tightly regulated, blood tests may remain normal until deficiency becomes significant. Symptoms may appear suddenly after illness or medication changes. This delayed presentation makes calcium imbalance difficult to recognize. Awareness of risk factors helps seniors and caregivers understand why calcium imbalance can develop quietly and why monitoring is important when symptoms appear. Managing calcium balance requires a careful and individualized approach. Seniors should not self-supplement without guidance, as excess calcium can also disrupt heart rhythm and cause other problems. Testing helps determine whether deficiency or imbalance is present. Treatment may include dietary adjustments, vitamin D optimization, or supplements under medical supervision. Because calcium interacts with sodium, potassium, and magnesium, correction often improves overall electrolyte stability. When balance is restored, muscle function improves, nerve symptoms ease, and heart rhythm becomes more reliable. This completes our overview of the 4 key electrolytes that quietly affect heart and brain health in seniors. In the final conclusion, we will summarize how these imbalances work together and what seniors can do to protect themselves. Understanding the full system empowers older adults to take proactive steps towards safer, more stable, long-term health. Electrolyte imbalances are one of the most overlooked health risks in seniors. Yet, they quietly affect the two most vital systems in the body, the heart and the brain. Sodium, potassium, magnesium, and calcium are not just minerals found in food. They act as electrical regulators that control heartbeat timing, nerve communication, muscle movement, and fluid balance. When even one of these electrolytes falls out of range, the body's electrical system becomes unstable. In older adults, this instability can quickly lead to confusion, dizziness, weakness, balance problems, or dangerous heart rhythm changes. What makes electrolyte imbalance especially dangerous is how quietly it develops. Symptoms often appear gradually or come and go. Many seniors assume these changes are simply part of aging, stress, or fatigue. Unfortunately, this delay allows imbalance to worsen. The brain becomes less clear, and the heart becomes more electrically sensitive. Falls, fainting, emergency hospital visits, and serious rhythm disturbances can follow. Yet, in many cases, these outcomes are preventable. The key message is awareness, not fear. Electrolyte problems are common, but they are manageable when recognized early. Medications, dehydration, illness, poor nutrition, and chronic conditions all contribute to imbalance. Seniors often have more than one risk factor at the same time. This is why routine monitoring, open communication with healthcare providers, and attention to new symptoms are essential. A simple blood test can often reveal the problem before serious damage occurs. Balance is critical. More is not always better. Taking supplements without guidance can be just as harmful as ignoring deficiency. Electrolytes must be corrected slowly and safely, especially in seniors with heart or kidney disease. Medical supervision ensures that treatment supports the heart and brain rather than placing them under additional stress. Daily habits play a powerful role in prevention. Regular meals, balanced hydration, medication awareness, and follow-up testing create stability. Seniors who understand how electrolytes work together are better equipped to protect themselves. Caregivers and family members also play an important role by noticing changes in thinking, behavior, balance, or energy. If you or someone you care for experiences unexplained confusion, weakness, dizziness, muscle twitching, or heart rhythm changes, do not assume it is normal aging. These may be early warning signs of electrolyte imbalance. Early action can prevent emergencies, protect independence, and preserve quality of life. Thank you for watching. If this video helped you, consider sharing it with someone who may need this information. Awareness saves lives. Always consult a healthcare professional before making changes to diet, supplements, or medications. Staying informed and proactive is one of the most effective ways seniors can protect both heart and brain health.